Anyway, we'd like to welcome Laura from the Outreach Department at University of Birmingham, who's going to give us a presentation, and then, as I say, we'll follow that by Q&A. Thank you very much indeed, Laura. We'll turn our cameras off as well. Okay, for now. Thank you.
Great, thank you everybody. It's really lovely to see you all. I know that you're here. Can I just check my sharing screen at the moment? I seem to have lost my presentation momentarily. Let me just share that again.
Yes, we can see that. Yes. We can't hear you, Laura. We can't hear you at the moment, Laura.
Okay, is that any better?
That's perfect, thank you.
Great, let's try again. The joys of presenting from home. How's that? Can everyone hear me?
Yes, that's great.
Brilliant, thank you. So yes, thank you very much for inviting me to come and speak to you this afternoon. I'm going to be talking to you about some of the healthcare programmes that we offer at the University of Birmingham, and as well as the Pathways to Birmingham programme as well. I should kind of just say to start off with, I know in the introductions it was mentioned that I'm an outreach officer at the university, so I don't actually work in any of the healthcare departments, but I can give you some kind of general information about the programmes we offer. And I know that beforehand there were some fairly specific questions, so if I can't answer those today, hopefully what I'm also going to be doing is signposting you to some other useful resources which you can then use to go and answer some of those questions that we might not be able to answer today. And the same if you're interested in a programme that's not offered at the University of Birmingham, hopefully there will be some useful information for you too. So this is what we're going to cover, as I said, healthcare programmes that we offer at UOB, some helpful resources which you can use as you research what you want to do in future, and then also I'm going to talk a little bit about the Pathways to Birmingham programme as well. So I just wondered if before we get started properly, it'd be really helpful if you could perhaps in the chat just write in the courses that you think you might be interested in at the moment. Doesn't matter if you're not entirely sure, but just to give me a flavour of the different kinds of things that people are interested in doing. So maybe if I give you 20 seconds or so to just pop that in the chat. Okay, thank you, that's brilliant. Can see them coming in now, so I can see midwifery, radiology, pharmacy, paramedic, radiology, nursing, speech and language therapy, physiotherapy, audiology, optometry. That's great. Orthoptist, dentistry. Okay, so there's quite a big range of courses there, some of which we offer, some of which we don't, but obviously it looks like people have really started to think about what courses they want to do, which is absolutely great. And that's what's really important, the thing to do really during year 12 is start making those decisions and start doing that research now. If you're interested in working in healthcare, there's over 350 different careers that are advertised just in the NHS, and then there's some careers that are outside of the NHS as well. So I popped a few on the slide there, and these are just some of them, some of which you may be familiar with, some maybe not so familiar with, but there's obviously loads more out there. And so it's really important that if you're interested in doing one of these courses, you really do your research and think about what's out there and what's going to suit you best, I guess. And that's something that we'll talk a bit more about later on in the presentation. So in terms of the healthcare courses that we offer at UOB, these are the main ones we offer, and these are all kind of patient-facing programmes. So these are all vocational programmes that tend to lead you into these particular career areas, and all of which involve dealing with patients and having contact with patients. So if you're interested in something like this, working with people is a really important part of the role and something that you need to be interested in doing. And again, we'll speak about this in a bit more detail later. But there's lots of other kind of patient-facing careers as well that we don't necessarily offer at UOB. Some other science courses that we offer at UOB, though, if you think you want to work in healthcare but not necessarily in a patient contact or patient-facing role, then you could think about something maybe more lab-based, biomedical science, biochemistry. These are some of the programs that we offer. Other universities offer things like forensic science and things as well. So there's lots of different opportunities for you to get involved in different areas of healthcare, depending on your interests and your skills. So what I'm going to do first of all is talk through some of those patient-facing programmes that we offer at the university, rather than the other science courses, but there's lots of information on the website if you are interested in any of those particular courses. So first of all, thinking about dental hygiene and therapy, this is a 3-year degree programme, and dental hygienists help or work with the dental team to prevent dental problems in adults and children. So undertake a variety of treatments on a wide range of patients, so things like scaling and polishing teeth, preventing and treating gum disease, for example, dealing with like particular issues that people are having with their dental hygiene. And will kind of have their own set of patients that they work with in conjunction with other dental professionals. Dental therapists undertake routine dental work, so things like x-rays, scale and polish, putting in crowns and simple extractions, so some of the kind of more routine work that takes place in a dental surgery. For this programme, the entry requirements are, and I've just mentioned A-level requirements here, but if anyone's doing other qualifications, then other qualifications for some of our programmes are accepted, and there's more information on the website. But in terms of A-levels, it's 3 Bs at A-level, including biology, and we'd also be looking for a minimum of 6 GCSEs at grade 4 or above, including English, maths and biology, or science or double science. So if you're interested in kind of dentistry, the grade requirements are quite high for dentistry, and I'll talk about that in a moment. But if you want to go into this particular area but are not quite sure whether you're going to get those higher A-level grades, then maybe this is something that you would want to consider. All students are interviewed for the course, and in the interviews, as for all of our healthcare courses really, we'd be looking for you to demonstrate that you've done some work experience, observation, so you've got a good understanding of the role. Now obviously at the moment, or over the past couple of years, it's obviously been quite difficult to get relevant work experience, and we do understand that, and so last year and this year we're being a bit more flexible with the work experience requirements for all our programmes, but I'm not sure. Obviously I think the hope is that by 2023 entry, when you'd come to start university, we'll be hopefully back to a bit more like normality, and it'll be a bit easier to get work experience again. But I'm going to share with you a really good website later on, which we've got at the university, which gives you some ideas of how to get work experience or get an understanding of a role, even if you can't get the traditional face-to-face work experience. Something else that we look for our dentistry courses is really good dexterity, and that means kind of being like having steady hands really, and being able to manipulate things, because you know none of us would want to go to a dentist and see them kind of shaking as they're about to take a tooth out or do a filling or something. So it's really important that you demonstrate those skills as well. So you could do that through things like maybe playing an instrument, or like craft or model making. So you can show that you have got those kind of like steady hands and those skills for kind of manipulating kind of small items as well. So studying this programme at Birmingham, we've got a purpose-built dental school and hospital which opened in 2016, which is just off the main campus, probably about a 15-minute walk from our main university campus. And you have patient contact from year 1 in this programme, so kind of building up to managing your own list of patients by the end of the degree, because it's obviously really important that as well as learning the scientific kind of knowledge that you need, you also have that experience of dealing with people and understanding the kinds of things that they'll be asking and the kind of situations that you'll be dealing with. And once you've finished the degree, you're eligible to apply for registration with the General Dental Council and work as a hygienist or therapist. And there's lots of opportunities in the NHS and in private practice going forward. So dental surgery, I've mentioned, this is to train you to become a dentist, so to diagnose and treat dental problems, disease, irregularities and injuries, so kind of have responsibility for a kind of overall dental care, and sometimes that's delegating work to hygienists and dental therapists, as we just mentioned. So this is a 5-year degree programme, and the entry requirements are 3 A's at A level. You've got to be doing biology and chemistry. And we also look for a minimum of grade 8 in your GCSE biology and chemistry, and 7 in maths and English, language or literature. It's a very competitive course to get onto, to be honest, dentistry. And it's the earlier deadline, UCAS deadline of the 15th of October as well. Again, all applicants will be invited to an interview and demonstrating similar kind of skills, knowledge, experiences to what I've just mentioned. And I think for all healthcare roles, it's just really important that you've got an understanding of what the role involves. That's really what people, what the universities want to see, that you've really thought about the role and whether it's something that you want to do. For dentistry, you also have to study the take the UCAT test. So that is the University Clinical Aptitude Test. And this kind of, it helps universities to select the best students for the course, so the people who've got kind of the best abilities and aptitudes and professional behaviours that they need for that particular programme. So medicine also requires students to sit this programme. And you don't need any prior knowledge, but it's exercises in problem solving, analysing material, deciding on kind of best solutions and things like that. And the UCAT tests normally take place between July and September. There's lots of resources on the UCAT website that I've mentioned there. So again, at Birmingham, similar to what I've just mentioned with the other programme, we've got the purpose-built dental school. You have patient contact from year 1 again. It's really important that you get to kind of meet patients and have that experience of working with patients. And then in order to qualify, once you've completed the degree programme, you complete a 1-year compulsory foundation training programme in order to then be able to register with the Dental Council and work within the NHS. And the majority of graduates would straight away go on to work in general dental practice, but then some might go on to careers later on in industry, hospitals, universities, for example. I'm going in alphabetical order, but I'm not going to talk about medicine in detail here because I know that one of my colleagues did a talk about medicine a few weeks ago. But if anyone is interested in medicine, then again, there's lots of information about that on our website. So I'm kind of concentrating on the courses other than medicine today. So the next course we come to alphabetically is nursing, which is a 3-year degree programme. And I think we pretty much know what a nurse does. Generally speaking, they provide direct patient care, but obviously the exact role that a nurse does will vary quite considerably depending on their specialism. So at Birmingham, the entry requirements are 3 B's at A level, preferably including biology, psychology or sociology. And we also ask for a minimum of 5 GCSEs, a grade 4 or above, including English, maths and a science. And again, all students are interviewed for the programme. So we're looking at that work experience, the observation, the understanding of what the nursing profession involves, and the demonstration of the skills that a nurse needs as well. So at Birmingham, you'd choose from child, adult or mental health nursing. So you apply for one of those degree programmes, but actually the first year is common across the programmes. So everyone kind of has that initial foundation programme in the first year. And that means that if you do decide that actually I applied for child, but I think maybe I'd rather do mental health nursing, for example, depending on availability, it is sometimes possible to change your course at the end of that first year. So you kind of study the scientific knowledge that you need, the scientific topics that you need, but then you also study the principle of kind of nursing practice, nursing skills, clinical skills, health communication, all those kinds of things as well. You do placements from the first year of the programme, again, making sure that you've kind of got experience of different nursing situations and also have that contact with patients. And there's a wide variety of placements depending on which area you're specialising in. And there's also an opportunity at the end of year 2 to do an elective or civic engagement placement. So that could be in maybe a specialist unit if you're interested in a specific area of nursing, or it could be sometimes if our students have placements in hospices or prisons. And we also have a number of students who travel abroad. So recently students have undertaken healthcare placements in Sri Lanka, Australia, Greece, so a number of different countries as well. So obviously that's been a bit tricky over the last couple of years, but hopefully as we move forward it'll be a bit easier to travel overseas as well. In terms of careers, once you've finished the degree, you're eligible to register with the Nursing and Midwifery Council. And There's loads of different opportunities for nurses in the different specialisms we mentioned, but then also to go on to clinical practice, management, research, education. You could choose to specialise in like theatre, surgery, nursing, those kinds of things. So lots and lots of different opportunities. Next programme I'm going to mention is pharmacy. This is a 4-year programme, and again we probably all have contact with pharmacists at some point in our lives. So a pharmacist role is to develop an expert knowledge of medicines and health, and to provide appropriate medicines and advice to people to kind of aid their well-being. And to support other healthcare professionals in helping people to kind of stay well and remain well. So in terms of this programme, the A levels that we ask for are 2 A's and a B, including chemistry and 1 other science. And we ask for a minimum of a grade 6 in GCSE maths as well. We've just introduced interviews for the pharmacy programme, so this is the first year that we're inviting students to interview, but again it would be looking for students to demonstrate similar things to what I've mentioned so far. Studying pharmacy at Birmingham means again that you'd be doing placements from year 1, and I think one of the things about studying in Birmingham is that we're one of the largest healthcare regions in the UK, which means that you would be working with a variety of people from a variety of different backgrounds, and encountering like a wide range of different situations and illnesses and things, because we've got a lot of kind of partners and as one of the largest healthcare regions in the UK, so that offers a lot of opportunities for your training and development. In terms of qualifying as a pharmacist, graduates must complete a 1-year pre-registration training programme once they've graduated from the degree, and pass an exam before then registering as a pharmacist with the General Pharmaceutical Council. And opportunities are, obviously in pharmacies and community pharmacies that you see. People can go into running their own businesses as well, so it's kind of that business element of pharmacy. Lots of different healthcare settings, and then students also go on to work in the pharmaceutical industry, in drugs development, in universities, government, regulatory bodies as well. And the final degree that I'm going to mention that we offer at the University of Birmingham is physiotherapy. This is a 4-year degree programme because it's an MSci programme, so it's actually a master's level qualification, so that's kind of a higher level than a standard 3-year bachelor's qualification, but you can do physiotherapy as a bachelor's as well. So physiotherapists help people to improve their mobility and regain independence after they've maybe had an injury or an operation, or as a result of ageing or disability. And the requirements for this programme are 2 A's and a B at A level, including biology, human biology or PE. We also ask for 7 GCSEs at a grade 5 or above, including a minimum of a grade 7 in maths and a grade 6 in English language, biology and chemistry. Again, similar to what I've said for all the other courses, I think with all healthcare programmes and the interviews, they're looking for that work experience, that observation, that understanding of the profession, but also of the skills that you need for that profession, and that demonstration that you've got those skills as well. I've mentioned that it's a 4-year programme at Birmingham, and from year 2 you take place you undertake placements in a wide variety of settings. So year 1 is a foundation year where you kind of learn that the basic knowledge, the anatomical knowledge, the biology, and that kind of thing. And then as you go into the second year of the programme, you'd actually start to apply that knowledge in placement settings. Again, you have the opportunity to undertake an elective placement as well between years 3 and 4 as well, and that can involve travelling to different countries if you want to experience kind of physiotherapy in a different country as well. Oh, apologies, skipping ahead of myself. In terms of careers, once you've graduated, you're eligible to register with the Health and Care Professions Council and the Chartered Society of Physiotherapy, and there are lots of opportunities within the NHS and outside of the NHS, so in hospitals, community settings, charities, care homes, sports clubs, for example. Football clubs have their own physiotherapists, for example. So lots and lots of different opportunities. Now, I appreciate that I've given you quite a lot of information about quite a lot of different programmes there, but all of this information is available on our website. So if there's anything that you're not sure about or that you're interested in, you just want to read a bit more about, then have a look at the website. There's a lot more detail on there as well about exactly what you'd study in each year of the degree programme. and the kinds of careers that people have gone on to in the past as well. And it also mentions, because all of our degrees are accredited by the relevant kind of bodies who approve people to go into that profession, and there's lots of information on their websites as well about the qualification routes and things, so it's worth having a look and doing a bit more research that way. I should also say as well that all of these entry requirements and things I've mentioned are current for this year, so 2022 entry. They do sometimes change from year to year, so just make sure that you have a look at the website and you're keeping up to date next year, because you'll be applying for 2023 entry or beyond. So just make sure that you double check that there's not been any changes when you do come to apply. So if you're interested in going onto a healthcare programme, maybe one of the ones that I've mentioned, or maybe one of the other healthcare programs, it looked like there's lots of different courses that people are interested in, then what do you do next? What's the next steps? Well, what I would say the key things are research, really. Do your research, make sure you are looking into the different courses available and looking into what you need to do in order to get into those courses. So obviously it's really important that you've got the relevant academic qualifications, both at A-level and at GCSE, but also is there any other skills that you need to develop or any work experience you need to do, and all those kinds of things that you need to have completed over the course of the next, I was going to say 12 months, it's probably a bit less than 12 months really, because you might want to get your applications in the autumn term of year 13. So, you know, what can you do really over the next few months in order to make sure that next year, when you're in year 13, you're in the best possible place for actually applying for one of these programs. So doing your research is really, really important. And I'm just going to go through a few useful websites and things that you can do to help with that research. And just excuse me, I'm just going to have a quick drink as well. Okay. So this is a really useful website. Some of you might have looked on this one already, but this is the NHS Health Careers website. And there is information about all of the different career opportunities that are available through the NHS on this website. So a really useful part of it is a Find Your Career quiz, where you answer different questions about the different your preferences, I guess, for what a working environment and what you like doing, what you're not so keen on doing, and that can help you decide on or come up with some potential options for a future career. So that's a really useful part of the website. There's also descriptions of all of the different roles. So I know that there were some questions asked before the session, when you registered before the session, about things like orthotists and psychotherapists, and they're not programs that we offer, but actually I looked up some of these programs on this website and there's loads of information on there. So I know that if you want to work as an orthotist, you need to do a specific degree program. So there's a few universities in the UK that offer that course. And they correct problems or deformities in nerves, muscles and bones. I didn't know actually what that profession was. I wasn't even sure. I'm not even sure if I'm saying it correctly now. But yeah, this website is a really useful place to look for information about different healthcare careers. And also there's a contact function as well. So if there's a question that you've got about a particular degree program or career, but you can't find the answer, that you can just submit a question through the website as well, which is obviously really useful. Another useful website, again, you might have looked at this one already, is the National Careers Service website, because this has got sections about different careers in lots of different sectors. So not just healthcare, whatever you're interested in, you can compare careers in the different sectors. So that's a really useful place to look as well. And FutureLearn is another useful website. So with this one, there's lots of different job profiles, and you can work your way back and see what qualifications you need for the different jobs. So again, that's a really important thing I think you need to look at over the next few months, is if you've got a career in mind, actually, what do you need to do to get to that career? Is it a degree program, or is there an apprenticeship route, or, you know, is there some other training that you need to do as well? So that's another useful website. Obviously the UCAS website. UCAS is the University and Colleges Admission Service. So when you apply for university, you apply through UCAS. And over the next few months, you'll be registering on there and starting your application. But there's lots of useful information about the application form, about the personal statement, things to include, and about the different universities that offer different degree programs. So if you go on there and type in optometry, for example, it would come up with a list of all of the different universities that offer optometry, and then it will link to their web pages as well, so you can go and have a look in more detail at those universities and those courses. So I know people are interested in optometry and audiology, and Aston University run those programs, but there's other universities across the country that do as well. So yeah, UCAS website is a really good place to look for the different courses that you might be interested in. As I said, they'll then link you to the university website. So I've just talked through a lot of the information about our courses, which is all available on our website. And some of the pages have like a day in the life of particular students from particular degrees as well. As I said, they talk about like the teaching and assessment, the entry requirements, because I know some of these are a bit complicated in terms of the entry requirements, and there's a few other things that you need to be aware of when applying for healthcare degrees, like you normally need to do a DBS, a disclosure and barring service check, for example, as well. So that will talk you through in more detail all of the different requirements for the programme. So definitely have a look at university websites, and bear in mind that I've talked to you about the entry requirements for the degree programmes that we offer at the University of Birmingham, but if you look at a different university that offers physiotherapy, they might ask for slightly different grades, or they might have slightly different requirements. So it's definitely worth having a look at different university websites and comparing the entry requirements between them as well, because they're not all going to be asking exactly the same thing. As I mentioned earlier, we obviously ask for, or what we generally look for is evidence of students having done work experience if they're interested in applying for our healthcare degrees, and we know that that's not been that easy to get over the past few years. So this web page on our university website is really it's got loads of useful links, resources, information, tips about different programs, some ideas of how you can get kind of different types of work experience, I guess, and how you can gain an understanding of the role without necessarily doing face-to-face work experience as well. So the link was a bit long to include in here, but I'll pop that in the chat afterwards as well, because that's a really useful web page to look at. And here are some specific UOB contacts for different programs as well. So each department has their own kind of admissions email address, and they will be happy to answer any specific questions that I've not kind of covered or mentioned today. And again, these are all available on our website, so you can always have a look on the website, and then if your questions aren't answered on there, feel free to get in touch. Another thing I would really recommend you do is visit university open days. Hopefully more places will start to have in-person open days over the next few months as well. You tend to find that most universities have open days, like the main ones are kind of June, July, and then September, October, November. So we had our last open day at Birmingham in November, and our next ones are in June. But some universities have open days at other times of year as well, and that website that I've mentioned there, that has a list of different university open day dates. But I would really recommend that you attend open days where possible, so that you can just experience firsthand where you'd learn, where you might be living as well, ask questions about the course to students and to staff as well, look at the other facilities that the university's got available to you, so what else might you get involved with when you're at the university, and generally just get a feeling for a place. So you know, you might think on paper somewhere looks like a good place to study, but actually when you get there you might think, oh, maybe this isn't the right place for me. So I think it's really important when you can to visit universities. And if that's not possible, then lots of universities have been offering online virtual open days as well. So definitely kind of make the most of those opportunities to visit universities or speak to staff and students. Okay, so that's in terms of doing your research and deciding which courses to apply for. There are hopefully some useful resources that you can use, and you can think about how you can make the most of those over the next few months. Something else I think that you need to think about over the next few months is the skills that you need for careers in healthcare, and how you can demonstrate what skills you've got, and also think about, you know, are there any gaps in your skills, and if there are, what opportunities can you undertake that would help you to develop those particular skills. So again, I wonder if you could just pop into the chat Any ideas about the skills that you think would be useful for healthcare careers? Now, I know it will vary a little bit according to what course you want to do, but just any ideas of skills that you think would be useful for careers in healthcare. And again, I'll give you a few seconds to do that. You can see we've got communication skills. That is definitely a useful skill for a career in healthcare. Social skills, yep. Ability to interact with patients, working under pressure, teamwork, definitely. They're all really useful skills. Compassionate and empathetic, yep, definitely. A few seconds and see if we've got any others. Yep, communication. I think it's really important because it's not just about your knowledge. Obviously, that's important. You have to, you know, if you're a dentist, you have to know about about the mouth and the teeth, and you know, you have to have that anatomical knowledge. But also, you have to be able to speak to people and explain that to people and have an understanding. And as someone said, their teamwork, it's really important because you're working as a healthcare professional, you're working with a team of other healthcare professionals. And so it's really important that you've got those skills that will enable you to do well in that particular career. And that is what universities and employers will be looking for as well. So it's not just the knowledge, it's those other skills as well. And I think I've come up with a few here. Okay, so I think all of the ones that you mentioned are covered there. But things like organisation as well, and problem solving, I think someone mentioned that, really important, like how do you deal with different situations? You definitely need patience as well. You need attention to detail, really important. You need to be motivated, you need to be approachable, manual dexterity, as I mentioned, for some programs as well. Resilience, so I think, you know, it's important that you kind of have that ability to remain calm in a crisis, so calm under pressure. You can think about clearly how to deal with a situation, but also then how can you deal with that yourself afterwards? If you've kind of dealt with quite a difficult situation, that might be difficult for you, so having the skills to kind of be able to deal with that as well. So lots of different skills, and it's, I think, depending on what program, what career you're interested in, it's a good idea to have a think about some of those different skills. Think about the skills that you've got, and think about, actually, are there any key skills for this role that I haven't got? And if not, can I develop those skills in some way? So I'm going to just talk about here the ABC method. So when you're thinking about the skills you've got, what you'll need to do when you're writing a personal statement for university is not just say, I did this, but talk about how you developed a particular skill. So, for example, here, what have you done? I played an instrument. Benefit, what skills have you gained from that? I've gained manual dexterity, and sorry, I've realised that some of this writing is not very clear, but how will this prepare you for the course? You need these fine motor skills to work with surgical equipment. So it's thinking, what have you done? What skills have you developed from what you've done? But how is that then going to help you in the programme of the career that you want to go into in future? So just thinking about that, I think, over the next few months, thinking, you know, if you work in McDonald's, for example, you might think, well, that's got nothing to do with working in healthcare. But actually, that's giving you communication skills, dealing with people, teamwork, problem solving, organisation, because you're kind of turning up there on time. So think about, even if it's not on paper, it's not directly related to what you want to go into. I'm sure that lots of you have developed kind of some of those transferable skills that are going to be useful to you in your future career. And another thing to kind of think about doing over the next few months is just keeping up with developments in healthcare and science as well, because universities will want to see that you've got that understanding and that just aware of what is going on in the world of healthcare and science. So keeping up with things in through news and through podcasts, newspapers, websites. And as I mentioned, there's lots of links to lots of useful resources on the University of Birmingham website as well. So just having a look at how you can keep up to date with some of those different developments and demonstrate your understanding once you have applied to university as well. Okay, so that was the end of the kind of healthcare section of the talk, and I was going to move on to pathways to Birmingham. I did notice, I think, one question regarding pharmacy. Apologies if I've missed any other in the chat, but does pharmacy include research? And if you mean in terms of during the degree programme, then yes, there are opportunities to get involved in research projects. And in terms of careers, then some pharmacists, some people do decide maybe after working for a bit to go into pharmaceutical research and things like that. But as I said, if you have a look on both the NHS website and on the university website as well, that will give you a bit more information about that. So if there's no other questions related to the healthcare at the moment, I can go on to talk about the Pathways to Birmingham programme, and then if you think of any other questions, we should have a bit of time at the end to go through those as well. So Pathways to Birmingham is a programme that we offer at the University of Birmingham. And we've got some Year 12 programmes and Year 13 programmes. So some of you might be interested in this, and they're not all related to healthcare. So even if you're not interested in healthcare programs, these are still relevant to you. So they are well-established programs. Most of them have been running for a number of years now, and they help students to gain an insight into university life, make informed choices, get support for applications, and generally get a bit of an understanding of university before you come to university. In order to apply for one of the Pathways to Birmingham programmes, you have to meet a number of eligibility criteria, and we look at a number of measures. So you normally have to meet 3 different criteria, and we look at things like the school performance, so the school you attended for GCSEs, postcode, whether your parents went to university, for example, household income. If you've got a disability or some kind of, you've had to miss periods of your education for particular reasons, for example. So we look at a number of things to determine whether someone is eligible for the programme. So that you normally need to meet 3 different eligibility criteria, but if you look on that website there, it goes through them in more detail and gives you a bit more information about what each of them mean. And students who then go on to one of our Pathways programmes will gain knowledge about different subjects at university, will gain support with their academic skills and some of the skills that they need for university. We'll learn about different careers, might get opportunities to undertake work experience, we'll meet new people, and also learn about kind of how to reflect and how to use reflection skills for kind of career and study development as well. The other benefit for students who are interested in going to the University of Birmingham and applying to us in Year 13 is that if you successfully complete a Pathways to Birmingham programme, you receive an alternative offer of up to 2 grades below the standard university offer for the programme that you've applied to. And you're also eligible to receive financial support. The eligibility depends on like Year 13 results and personal circumstances, but you would be eligible to kind of be considered for financial support as well. In terms of the alternative offer, this just gives you an example of what we mean by that. So if you successfully complete a Pathways to Birmingham programme and you make University of Birmingham your firm choice, then you can receive the Pathways offer for the course that you've applied for. So for example, if we talk about biomedical science, a standard offer is 2 A's and a B, and a Pathways offer is 3 B's, plus you would have to pass the Pathways programme. So the offer that you would receive, you basically get 2 separate offers for the programme, that standard offer and the Pathways alternative offer. As I mentioned before though, entry requirements do change from year to year, so do make sure that if you are interested in applying to the University of Birmingham, you're looking next year for any updated entry requirements. And as I mentioned as well, you could be eligible to receive up to £3,500 per year of study, although again with the financial support changes from year to year as well, so that's how it currently is, but it does vary, so you would need to just make sure you've got the up-to-date information next year, and the eligibility is based on a range of criteria. So again, more information is on our website. So in terms of the Year 12 programmes that we offer, we have our Routes to the Professions programme, or unfortunately the applications are passed for that now. So some of you may have already heard of that and may have applied to that. But we've still got 2 other programmes, Inspired at Birmingham, the Academic Enrichment programme, and we'll be opening applications for those at the end of January. So I'm just going to talk through a little bit more about those. So Inspired at Birmingham is for people who want to go to university, maybe particularly a Russell Group university like Birmingham, but aren't quite sure what course they want to do. So I know quite a lot of you who are attending this session today do know that you want to go into healthcare, but if you're not quite sure, then this is a programme for you. So there's a range of different subject insight sessions, talks from graduates, career workshops, academic skills support, application support. And it's mainly focused on non-vocational courses, so looking at the non-vocational courses that we offer at the university and the types of careers that you can go into, and then providing support with the application process through mentoring as well. So that's Inspired at Birmingham. That's Inspired at Birmingham, and that is a series of on-campus events and some online workshops and mentoring with current students that will generally, most of it will take place during the summer term, so starting just after the Easter holiday and continuing through the summer term. We also have the Academic Enrichment programme, and this is a summer school. So this takes place in August in the summer holidays. And this is an experience of university life because you actually get to stay on campus, take part in academic activities during the day and social activities in the evening, staying in our halls of residence. And there's a number of academic streams for that. So we have got some of the healthcare courses in this programme. And students are divided up into one of those academic streams and then attend different subject workshops relating to those streams. Then also have the opportunity to take follow-up study skills sessions, e-mentoring, as I said, paired with the current university students, so similar to the Inspired programme in that sense. But the difference is that the Inspired programme is non-residential and takes place over a number of weeks during the summer term, whereas the Academic Enrichment programme is that 5-day, 4-night residential that takes place in August during the summer holidays. Whichever Year 12 programme you do, you would complete a reflective activity. So we ask students to really reflect on what they've done during the programme and their strengths, their experiences, and think about how that's going to support your decision making and your progression to university. And then also think about, are there any gaps? Is there anything else that I need to do in order to further strengthen my university application or prepare me for the transition to university? So we ask students to reflect on their experiences and then write a reflective assignment which is submitted to us for assessment at the end of the programme. It's fairly straightforward. It just helps you to develop that understanding of how to reflect, and I think that's particularly important if you want to go into healthcare careers. It's something that you'll be asked a lot about, I think, in interviews and things as well. All students have to complete the Skills for Uni as well, which is an online study skills challenge helping prepare you for independent study at university. There's a number of different modules you complete, so it covers things like referencing and researching, and then you have to pass a quiz at the end of it in order to pass that element of the Pathways to Birmingham programme. So basically, to successfully complete a programme, you complete that Skills for Uni quiz, you complete the reflective activity, and then there's also minimum attendance requirements for each programme. So for the summer school, it's obviously attendance at the summer school and engagement with the mentoring, and then for Inspired at Birmingham, it's attendance at a certain number of the programmes and engagement with mentoring as well. So if you're interested in applying for one of these programmes, you can look on the Pathways to Birmingham website. As I said, applications for them are not open at the moment, but you can register your interest on the website at the moment, and then we'll be opening applications right on the end of January. Hopefully it'll be January the 31st that applications go live, and then there'll be more information updated on the website with regards to the dates that you need to be available to complete the different programmes. So you go onto the website and check your eligibility, and then you have to complete an online application form. So that's just some information about the grades, the subjects you're studying, the grades that you're doing, because there are sometimes academic requirements that we've got depending on what course you're interested in doing. and then you can submit your application through that Pathways to Birmingham webpage. When you apply, you select the school that you are attending, and then that will automatically put in the name of the coordinator at your college, who has to verify your application before it then gets passed to the Pathways to Birmingham team to review and to assess. So basically you need to get the support of your college in order to apply for the programme. So the Pathways to Birmingham coordinator at the school will be able to complete their section and pass it on to us. So as I mentioned, the Routes to the Professions programme is unfortunately closed for this year, but Inspired at Birmingham and Academic Enrichment Programme applications open in January and will close mid-March. I can't remember the exact date, but it's about mid-March, so you'll have kind of 5 or 6 weeks to submit an application. Inspired takes place during the summer term and the Academic Enrichment Programme takes place during August. There are limited places on these programmes, so if you don't get a place on one of the programmes, or if you are not really sure if you want to do one of these Year 12 programmes, but then you do decide to apply for Birmingham next year, we also have our Year 13 Access to Birmingham programme, so you can apply for Access to Birmingham alongside your UCAS application. And again, there is certain things that you'll need to complete as part of that programme, so you'll need to do the Skills for Uni test I mentioned, you'll need to do an assignment and attend a seminar, a subject seminar. But again, if you complete A to B successfully, you'd be eligible for that same reduced offer that I mentioned earlier. So if you don't get a place in one of the Year 12 programmes, but you're still interested in going to Birmingham, there is the opportunity for you to apply to A to B in Year 13 as well. So I realise I've given you quite a lot of information over the last 45 minutes or so. As I said, there is a lot more information on our website about everything I've mentioned, but I'm happy to try and answer any questions here if I can, if you've got any. If not, as I said, if they're specific questions, then I can hopefully some of the resources I mentioned will help to answer those questions as well, or I can potentially take those away to the university and ask colleagues. So hopefully everyone can hear me, because I've got a message saying that I've got bad network. So apologies if any of that's been difficult to hear.
No, we've been able to hear you the whole time there, Laura. That's been great.
Oh, good.
Yeah.
Great.
Can I just say that's such a comprehensive coverage, I think, of what students need to be looking at right this moment, and you know, you've been incredibly comprehensive and generous with your advice around just the healthcare subjects as well as specifics. We have added to the chat, Faye's been typing those in, any kind of responses to specific questions that students asked in advance. But I think just before we kind of take any further questions through the chat, and please students do put those in the chat, I'd just like to reiterate, if I may, on behalf of the careers team, how important some of those extra elements are to be doing at this moment in time and from now onwards. So your emphasis, I think, Laura, on research is critical for students to be doing at this moment in time and from now onwards. Using the tools that you've put forward, which were absolutely great, and also we use a platform called Unifrog, and there are other websites that will continue to ongoing recommend to students. This week, out of interest, Laura, students in Year 12 are receiving sessions from their personal tutors on the importance of work experience, how to develop those skills and identify those skills that are needed for the various sort of careers that they're looking at. And I think how to go about looking for experience in the workplace and engaging with you know, employment and careers per se is really critical at this time. So thank you for emphasising something that students are currently going through at the moment as well with their personal tutors. The other thing that I would encourage students to do is very much record their experiences, because I'm sure you'll agree, Laura, that sometimes when students are both looking at examinations and assessments, but also looking at university routes and alternative routes, there's enough for them to do. So actually recording experiences and, you know, skills and developing a sort of almost a portfolio, in whether it's a mind map, whether that's a list, however students work best, is really good advice, I think, to collate all of that information now, and don't leave anything out, because it all matters. And during these very complex times of gaining experiences, I think it's important that students actually do kind of keep a record of everything that they do. Everybody, you know, if they're emailing to ask for a part-time job, those emails are interactions, as it were. So it's about kind of understanding those connections. So that's great. Are there any further questions that students might have? I can't see anything in the chat at the moment. We did have a few questions that were asked beforehand that were not specific to actual courses, but apart from work experience, Laura, what opportunities or activities should I look out for which help improve my application for university? So it's not just work experience. What other kind of things can they sort of pack out and use for their applications?
I think that universities are always interested in knowing about what you're interested in outside of your degree programme as well. And so anything, but they're interested in it in terms of the skills that that's given you, I guess, that will help you with the degree programme. So as I mentioned, you know, if you've got a part-time job, or if you have the opportunity to do a part-time job or some volunteering experience, then that's great, because that can help you to develop some of those skills that we've mentioned. So those communication skills, the organisation skills, the teamwork skills. So anything like that, I think if you can get some volunteering work, if you're interested in healthcare programmes, that's really useful. You know, if you can work, I don't know, in a care home or with young people or anything like that, that shows that you've organised it yourself, that you're getting experience of working with people, that you're developing that understanding, those kinds of things look really good on an application form as well. And anything else that you do, I don't know, you might be part of a sports team or an orchestra, you know, again, you're developing really good skills by doing things like that. So I know that it probably feels like, oh my goodness, I've got all this stuff to do in year 12. I've got to do all this research and get all this experience and try and, you know, do as well as I possibly can in my exams as well and in my studies. But actually don't forget that those things that you do outside of your studies are really important as well. And, you know, they'll give you skills that you need to be successful at university, but, you know, might open other doors for you when you get to university as well. So don't forget to kind of keep up with things like that.
Thank you, Laura. And I think from student perspective, King Edward's encourages all students to participate in work experience, but it is that wider engagement in enrichment activities, seeing that, you know, involvement in projects on recycling and getting involved in the community. We actually store on our Moodle pages, as well as on the website, a lot of information about volunteering and work experience and opportunities now on enrichment. So getting involved in those kind of activities can demonstrate the kind of skills, as you say, and interaction in the community that I think students will very much benefit from in their application, whether that's for an apprenticeship, whether it's for university applications and for the future. I can't see anything else in the chat at the moment, and I think probably we had one more question about, let's just have a look, what can I do if I didn't take a subject needed for these types of careers? Can we kind of still give some advice for students who may not have done all of those subjects that they need, but obviously, you know, perhaps still want to look, and there are kind of perhaps stepping stones that they could take, Laura?
Yeah, sometimes it's possible to do another degree first and then do some kind of conversion programme for particular careers. I believe there are some universities that might offer foundation programmes as well. So I don't think we offer one at Birmingham for any of our healthcare programmes, but I think there might be some universities that do offer foundation programmes for students who haven't necessarily got those, got the right A-level or equivalent subjects. And it's worth looking on that NHS website, I think, because there are different qualification routes for some of the careers as well. So sometimes it's not just, you don't have to have a degree to get into all healthcare careers, for example. There's other routes into some of them. So I'd recommend maybe having a look at that website and seeing if there's different roles that might be suitable as well.
Thank you, Laura. That's really helpful. Well, as I can see, we haven't got anything else in the chat. I will say thank you very much indeed, Laura. That's been extremely comprehensive. And oh, we've got one just popped up. Do you know if any hospitals in the area offer work experience? I think probably we have some information that careers might be able to help as a department on that. So Sana, who's asked that question, perhaps you could email careers and we'll try and find you some information. Similarly to pharmacies, as I think Aisha has just asked as well. So we'll address those. If you could address those to the careers@keds.ac.uk email address, and we'll talk to you. Thank you, Faye. We'll talk to you about those specific questions, and we'll try and address those when we send out the presentation, Laura. If we may have that your presentation to circulate, we'll try and address some of those as well, so that there's some more information coming out. Thank you very much indeed, Laura, for taking the time out. I hope that students have benefited from that, and on their behalf and on ours, I'd like to thank you. And I'm sure that we can forward any questions to you if anything comes out after this.
Yeah, thank you. Please do. I've just put the link in there to that page I mentioned as well, which has got lots of useful kind of resources and links to useful websites for different healthcare careers, and also some information about alternatives to face-to-face work experience. So that's quite a useful web page. And yes, I can send you the presentation. That's fine.
Thank you. And I can see there's a sort of a question about progression and process for applying for uni. Those are the kind of things, Samir, and any students who are left on here, we will be, from careers and with your personal tutors, be concentrating on all of those kind of things in our progression topics that will be continuing to develop after this first week on work experience. We'll be developing the UCAS process applications as we go through the next 2 terms, and also for apprenticeships and additional gap year information, etc. So we will be answering those things as we go through. Right, thank you very much indeed all for attending. We will have recorded this, so we'll post that up, and in the meantime I wish you all a good evening. Thank you.